Cheers.
Cheers.
And welcome to Wine Wednesday with Kriz Physical Therapy. I am Dr. Tiffany Kriz.
And I'm Dr. Mike Kriz.
And on this episode of Wine Wednesday, Dr. Mike is going to give us a little bit more information about dealing with arthritis in your neck, but yet you continue to want to play golf, and how you can prevent injuring yourself and why we have a specific program just for you. So go ahead and take it away, Dr. Mike.
Okay, when you're swinging a golf club, and let's say you're a right-handed golfer, you're taking the club back in your backswing, you're looking over your left shoulder. And conversely, when you're in your follow-through, you're looking over your right shoulder. So if there's a limitation in that ability to turn, or it's difficult to do, then your swing isn't going to be as free and easy. You might miss-hit the ball often, but it's going to cause some stiffness and pain throughout the round. So we have to look at not just what happens at your neck, but also because it's directly associated with your thoracic spine, and because it attaches to your spine, your rib cage. Those two areas have to be able to move freely as well, so that when you turn your head, there's less stress and strain on the muscles that hold your head to your shoulders and to your spine. Also, we'll look at your shoulders and see whether or not you have adequate mobility there. And if we want to take it further, we can even look down into the legs. So there are a lot of things that we look at, and not just observe whether you have that mobility, but then do you have the strength? Do you have the endurance to get through a full 18-hole round or even a 9-hole round and not feel like you're stressing or straining your neck, so that you don't feel so fatigued, you don't feel so sore and tight afterwards.
All right. Thanks, Dr. Mike. And thanks for watching. We'll see you next week.